Hi, everyone. Thank you for joining us for today's webinar, Harnessing the Power of CBD, Enhancing Women's Health Through Cannabinoid Therapy. My name is Robin Pearson. I'm the Senior Brand Manager at L.Ac OMS. Our webinar presenter, Dr. Chloe Weber, developed an interest in public health and medicine after being diagnosed with a medical condition in high school. She set out in college to understand how diseases evolve and the deep connection between humans and our environment. Eventually, Chloe was drawn to Chinese medicine as a way to address public health issues and graduated with a Master's of Oriental Medicine from Southwest Acupuncture College. After graduating, Chloe co-founded a nonprofit sliding scale walk-in Chinese herb clinic called Urban Herbs. Running her clinic, Chloe was able to dive into her study of herbs and found great joy in community outreach. When Chloe's son Remy was diagnosed with a rare genetic disorder causing global delays in catastrophic epilepsy, she moved home to New York to focus on supporting him and also started her own private practice. Working with Remy has led Chloe to extensively study integrative neurology and functional medicine and has motivated her to find ways to help children with neurodevelopmental issues and seizures. As a mom on a mission, she turned to hemp extracts, but knew that the current one-size-fits-all approach to hemp was not the most effective way to work with this powerful plant. Chloe joined forces with Bart Beckerman, also a licensed acupuncturist, and they figured out how to potentiate the actions of the hemp with Chinese herbs, and together they co-founded Radical Roots. Using high-quality hemp and herbs and a unique and effective extraction technique, they created their popular oils, capsules, and topicals under the Radical Roots name. Now for the presentation, but before we start, let's just take a moment to acclimate to the webinar room. To the bottom right of the screen, you'll see 3 tabs: Questions, Chat, and Polls. To connect with other attendees or notify us of any difficulties, please use the Chat tab. At the end of the presentation, we'll use the Chat tab to post a promo code specific to this event. If you have any questions for Dr. Weber, please use the Questions tab. Your questions will be answered at the end of the lecture during our Q&A session. We added 2 questions to the Polls tab, so be sure to add your responses to both. Please note that each webinar is recorded, and immediately following the conclusion, you'll receive a link to view the video on demand, a copy of the slides, and the promo code to use on your next order at L.Ac OMS. So without further ado, I'll pass it over to Dr. Chloe Weber.
Hey guys, I'm very excited to be here, and I just wanted to give a quick shout out to our dear friends over at L.Ac. I know a lot of you guys work with them to supply your clinics. I don't know how much you guys are working with the team one-on-one, and I can just tell you that their team is absolutely the best. So I'm really grateful to be here. I'm really grateful for all they do for our community, and I'm really excited to chat with you all today about CBD and women's health. So as Robin just mentioned, I'm the co-founder of Radical Roots. I'm obsessed with using Chinese herbs for public health intervention. I'm also obsessed with getting us all out there, educating people on what Chinese medicine has to offer. So throughout this presentation, I'm also going to encourage you guys to get out there and educate your community, get on podcasts, talk to people about what Chinese medicine, natural medicine, herbal medicine has to offer, because if they don't know the power of the medicine that we have, then we're never going to reach our full potential. And we have so much that we can do to support our society right now. So let's get at it. Maybe. What did I do? Oh, I'm in the chat. Okay, so Radical Roots. So with hemp, you will find out in this presentation that hemp is a bioaccumulator. So it's a fascinating thing because what it does is it pulls toxins from the earth. It also potentiates topsoil. So what I love about hemp and why I'm obsessed with this plant is that it's not only deeply intertwined with our own nervous systems and our ability to regulate our endocannabinoid system, but if you're buying biodynamically grown hemp and supporting companies that use regenerative growing techniques, then we're actually healing the earth while we're healing ourselves and our patients. So it's really important to find the right hemp when you're using this. So as many of you guys know and have seen, the increase in hormonal and mental health disorders in women has been astronomical over the past 10 years. So this chart goes from 2015 to 2020. I would guess that this is going radically higher since then. So we've got almost 40% of women with a mental health disorder at this point, and about 30% with some sort of hormonal disorder. And many of you guys have seen and know that there is a boom in women's health right now. So it's getting very popular, which I always think is entertaining because guess what? As women, we are not only 50% of the population, but we made everybody that is here. So it's slightly important that we actually take care of our health. And it's also very important for us to take care of our health so that we have healthy children, right? Which is also a huge epidemic right now as well. So I don't know how many of you have taken the poll yet, but I'm curious how many of you guys have been using CBD in your practice and how many of you work with women in particular. But so I'm going to give a brief overview of the endocannabinoid system. If you need more, you can always check out one of my previous webinars. I've done 2 others with L.A.C that go into one on neurological health and the endocannabinoid system, and one was sort of CBD through the lens of Chinese medicine. So L.A.C has those both accessible for you guys. But basically, CBD is a part of the cannabis plant, right? It does not get you high. It is basically cannabis that's been bred to have a lot of this one cannabinoid called CBD. So there are over 113 different cannabinoids in the cannabis plant. CBD and THC are the ones that have been most widely studied and most used clinically. So THC is responsible for the classical psychotropic effects that you see from marijuana, whereas CBD is used clinically, often for pain management, for anxiety, for sleep, for immune support. I've been really blown away by the research on it for gut health, as well as various neurological conditions. Obviously, a lot of people got into it for its ability to support kiddos with epilepsy, and that's certainly why I got into it as well. But for those of you who don't know, the endocannabinoid system is basically a master regulatory system within our body. And this system actually develops in utero before our nervous system develops. So that just shows how incredibly important and powerful it is for modulating nearly every aspect of our health and well-being. So CBD is able to work with this endocannabinoid system and is able to modulate it so that we are able to feel better day after day. So the endocannabinoid system is made up of these 2 main receptors. So the CB1 receptor and the CB2 receptor. The CB1 receptor is primarily found in the brain, the reproductive organs, and the peripheral tissues. And it's largely responsible for pain modulation, mood regulation, and hormonal balance. CB2 receptors are more connected to our immune system and our peripheral organs. So it's primarily involved in immune modulating actions, as well as modulating inflammation and cellular repair. Slightly important aspects of health, right? So what's interesting about CBD is that CBD, we have these endogenous cannabinoids, right? So we make our own cannabinoids. The 2 main ones are anandamide, which is also known as the bliss molecule, and 2-AG, right? So we make these endogenous cannabinoids and they're released from our system when we're under stress. But then these cannabinoids are broken down by these enzymes, the FAAH and the MAGL. So basically when we're under chronic stress, we're burning through our endogenous cannabinoids, leaving us at a state of cannabinoid deficiency. And this is something that I think is really, really important for everybody to understand, because I think that this is the primary basis of why there was such a massive hemp boom a couple of years ago. Because when hemp was taken out of our diets and out of the diets of the animals that we eat about 100 years ago, we started leading a life where we're not ingesting hemp. And we started seeing a rise in all of these other issues that are going on, these autoimmune disorders, these reproductive disorders, these cancers that are blowing up. So I do think that a lot of that comes back to the endocannabinoid system and making sure that we're regularly supplementing with a high quality exogenous cannabinoid from a high quality hemp product, so that we're able to support and regulate our endocannabinoid system, so it's able to regulate and support our bodies, our health, and our well-being. So I was really fascinated by a lot of the research that I found. I hadn't dived into CBD and its effects on women's health very much before starting this. It's sort of why I signed up for this lecture, to push myself in order to study this a little bit more. But it's really fascinating, the research on how the endocannabinoid system interacts directly with estrogen. So they're deeply intertwined, and there's endocannabinoid receptors throughout our reproductive system. It's also really connected to our ability to create life, for fertility. And you'll find out that it's many of these hormonal-based disorders like PCOS and endometriosis are connected to endocannabinoid deficiency or endocannabinoid system dysregulation. So let's go. I feel like I'm missing a slide here. What did I do? Okay. So we all know how essential the HPO axis is for regulating women's health and hormones. And what's very interesting is that the neuroendocrine axis coordinates the interaction between the hypothalamus, the pituitary gland, and the ovaries. And the endocannabinoid system is deeply connected to this also. A lot of this, so basically it interacts closely with the hypothalamus pituitary ovarian axis, and also steroid hormones like estrogen, progesterone, which thus impacts fertility, menstrual health, and menopause. So it's really important in order to make sure that we're regulating that system so that women's hormones are properly functioning, and so that we're able to regulate that system overall. Again, the epidemic of hormonal disruption is out of control. So many of you may know that acupuncture has actually been researched for its ability to affect the endocannabinoid system. And this isn't particularly surprising to anybody who's taken CBD or who has gotten acupuncture, because the feeling can be quite similar. So it's really interesting to see the research that's coming out. Dr. Ayla Wolf, I believe, has a CEU course on how she was using e-stim at pericardium 6 in order to activate the endocannabinoid system. And that makes a lot of sense also, and might be an interesting pathway for treating women with hormonal disruptions, because obviously PC6 over here is also associated with the Chongmai. So for those of you who are not acupuncturists, that is a meridian that is deeply connected to women's health as well. But I do think it's really interesting to see that the ways that we're able to regulate the endocannabinoid system with and without supplements. Another very important thing for us all to note is that hormone disruptors do also disrupt and dysregulate the endocannabinoid system. So I have been on a microplastics nerdy tear for the past couple of weeks, and I'm absolutely terrified at what is going on in our bodies when these microplastics are being consumed. They're finding clots of microplastics in people's brains. They're finding evidence in our ovaries, in men's testes. It is really, really terrifying. So as we work with our patients to help them restore health and restore their hormonal balance, it's also essential that we work with them to reduce these toxins in their day-to-day life. I'm sure all of you have so many great tools in order to help your patients detox, but reducing the amount of exposure is number one. I love infrared saunas, dry skin brushing. I even have a ionic foot detox, which I don't honestly know what it does, but I can tell you when I do it, my sleep scores go through the roof, and my HRV, my heart rate variability, also skyrockets. So there's something positive going on in there, and the research in it is pretty interesting. So getting one of those for your clinic might be a great addition and a great way to make some extra cash. The one that I have is the Ion Cleanse by AMD. I'm looking at it right over there. But again, getting rid of these pesticides. I mean, I interviewed Stephanie Seneff, who's the leading researcher at MIT on glyphosate, and the ways that glyphosate is impacting hormonal health is truly, truly terrifying. So making sure that your patients are aware of these hazards and reducing their exposure is huge. One of the things that I found pretty interesting is that there's some research showing that pain management through the endocannabinoid system is different in men than in women. So what this research was indicating was that women were more sensitive to THC for pain management because we have an increase in CB1 receptors. And it also showed that estradiol increases CB1 receptor expression, which enhances CBD's analgesic effects. So some of CBD's benefits when it comes to chronic pain are not only its anti-inflammatory actions by activating the CB2 receptors, but it also modulates serotonin and dopamine, which reduces neuropathic pain. CBD is also an allosteric modulator of opioid receptors for pain and chronic inflammation. And several studies have shown that cannabinoids downregulate cytokine and chemokine production. And in some models, they actually upregulate T regulatory cells. CBD is also an analog to capsaicin and acts on the TRPV1 receptors, which many of you guys will have heard of those receptors because they're really important when it comes to pain modulation. So these are just something to keep in mind in terms of some of the biochemical pathways that CBD is activating in order to help reduce pain in our patients. And obviously, so many women are dealing with really severe pain disorders. All right. So a lot of this is going to be overlapping because we see a lot of the same issues in these hormonal disorders, right? So number one, let's talk about mood disorders, right? So what does CBD do to support mood disorders? Well, one, it works on the 5-HT1A pathway, right? That's the same pathway that SSRIs work on. It also increases neurogenesis in the hippocampus, which is why it can be really helpful in working with patients who have PTSD. It also works on regulating the vagus nerve because there are receptors for CBD and for the endocannabinoid system throughout your vagus nerve. So, I mean, I can't think of anything that does such a great job at helping alleviate stress. In terms of Chinese medicine, as we look at this herb, it really is a Shen tonic. It's powerfully calming the heart and nourishing the heart and helping us find our center again. We really look at it as bringing things back into the Goldilocks zone, the middle way, right? So I always tell people who buy my Radical Roots products, it's not necessarily going to be an overnight, my entire life has totally changed and I'm a different person. But what I want to see when you're taking a high quality CBD product is that you're going to feel more like yourself, right? And that's what I find personally, and that's what I find clinically as well. So we already talked about the importance and the various ways that CBD is able to help with pain management. But we also want to talk about the reduction of inflammation. So how many of our patients are dealing with chronic inflammation? You know, it is absolutely pervasive. So the anti-inflammatory effects of CBD, the most potent one is really how it's interacting with the TRPV1 receptors. And this can really, really, really dramatically help with cramps, bloating, and breast tenderness. I feel like I'm talking very fast. I'm sorry. I'm from New York and I drank too much coffee. But let's keep going. It's also funny doing webinars because you're just sort of talking to yourself and you don't get any feedback. So just a note for those of you who are going to do webinars in the future, which I, again, encourage you to do. It's a little entertaining. So CBD will also help modulate the endocannabinoid system. As I mentioned, this is going to help regulate hormone production by regulating the HPO axis. It's going to reduce inflammation. It's going to help with pain perception. And it's really going to help with that immune response as well. It's also going to help women get better quality sleep, which is something that we see a lot in our patients who are dealing with PMS and PMDD. Okay, CBD for endometriosis. So this was really interesting to me because there's a lot of research that indicates that endocannabinoid dysfunction is correlated to endometriosis. I found it really fascinating. I highly recommend you guys look up some of the studies or email me and I'll send you a link to some of them. But this dysregulated endocannabinoid system is highly correlated to endometriosis, which suggests that exogenous cannabinoids may regulate and prevent the condition, warranting further research. So what they're seeing in the research is that endometriosis involves chronic inflammation, immune dysfunction, and pain. Again, these are the things that CBD is so incredible at supporting. So CB1 receptors are expressed in the sensory neurons around the endometriosis lesions. And so that can be helpful in modulating pain. And the TRPV1 receptors tend to increase in the endometrial tissue, which can worsen pain perception. So again, being able to modulate it with a high quality full spectrum product is going to be really helpful because it's going to reduce inflammation through the CB2 activation. It's going to modulate the TRPV1 receptors, reducing the hyperactive nerve signaling, and it's going to regulate hormonal balance, potentially slowing the actual endometrial growth. So it really can help not only with the pain management, not only with the quality of life, but there's significant research indicating that it might actually slow the progression of the disorder or prevent it altogether. And I know that this is something that so many of our patients are dealing with. So I highly recommend that it's something that you try with your patients. I use my relief remedy for a lot of my patients with endometriosis. It's filled with herbs that are going to move the blood, move the chi, and alleviate pain. And I found that one to be really, really highly effective. So CBD for fertility and pregnancy. This one's pretty interesting because there's mixed research on it also. So the research is very clear that CBD is highly integral, or the endocannabinoid system is very integral to a successful pregnancy. So again, we're going to see that the endocannabinoid system plays a critical role in implantation. Research has shown that increased levels of anandamide are associated with miscarriage risk. Low FAH levels are linked to implantation failures. So low FAH, again, that's that enzyme that breaks down anandamide. And then ectopic pregnancies correlate with high anandamide and low FAH in the fallopian tubes. So really what that breaks down to is that CBD may be able to help regulate uterine contractions and increase blood flow to the uterus. It could also reduce immune overactivation, which improves pregnancy success rates. But we want to be careful about how much we are giving our patients and what kind of products we're giving our patients, because the research also indicates that excessive endocannabinoid system modulation may interfere with implantation. So basically, again, we want to find a balance zone there. So what they're saying here is that the increase in these endogenous cannabinoids and the decrease of the enzymes that are breaking that down can lead to disruption in successful pregnancies, whether it's ectopic pregnancies or difficulties with implantation. And so we want to support the endocannabinoid system, but we want to do it with a full spectrum product so that we're getting all of the other phytoactive chemicals that are in the plants. And we also want to be cautious during pregnancy. So there is some research out there that also shows that during pregnancy, it can increase contractions. So it's a little bit dicey. When I went down the rabbit hole of the research that was sort of saying that CBD during pregnancy was dangerous, a lot of it was sort of hypothetical. I didn't see any actual research that had been done on using CBD during pregnancy. So my understanding of it and my understanding of the plant overall is that supplementing with a moderate base of a whole plant formula is likely going to be safe and effective for your patients. Is that something that you're comfortable recommending? Is that something that the patient's comfortable doing? There certainly isn't good research on it, but there is good research on showing that CBD is safe and effective and helps regulate all of these various hormonal systems within our body. So to me, if it was me and I was pregnant again, I would probably feel pretty comfortable taking my products, to be honest. And I would certainly look to CBD as a potential option if my patient was dealing with postpartum issues or depression during pregnancy, as an alternative to some of the pharmacological options that might be given, because to me, those are likely more dangerous than the CBD. We also do, we have our endogenous cannabinoids. So those are already going into our children when we nurse as well. It's cold in here. Okay, menopause. So menopause and the endocannabinoid system. So menopause, as we know, is a drop in estrogen, depletion of estrogen, which affects metabolism, bone health, and cognitive functions. All things that CBD is fantastic for. So the endocannabinoid system plays a key role in managing menopause symptoms. So basically, CB1 activation increases food intake and reduces stress, as we talked about, and it supports neuroprotection. CB2 activation decreases bone reabsorption, lowers inflammation, and supports vascular health. I have been really blown away, again, on the research of CBD in supporting bone health and the research of CBD as a neuroprotectant. So those are really important things that women are dealing with. Again, I think that it's incredibly important for Chinese medicine and alternative medicine to get in on this new trend of women's health and start making people aware of what we have to offer as a field. So with menopause, CBD can support menopause symptoms by regulating body weight. It can reduce anxiety and mood swings and also support bone density. So when we're talking about menopause, it's also important to talk about gut health, right? So just a brief breakdown of some of the ways that CBD helps with gut health. It is able to tighten tight junctions. So it helps with the gut lining integrity and reduces leaky gut. It reduces inflammation in the gut. It helps with IBS. It increases Mucophilia akkermansia, which I'm probably saying wrong, but as you all know, that is the very hot probiotic these days, and it has been researched for its abilities to support people who are dealing with MS and epilepsy. So I really do think that one of the main ways in which CBD is supporting neurological health is by supporting our gut health. So that is something that I think is largely overlooked when it comes to CBD, but I think it's actually incredibly important. There's also really wonderful research on its ability to reduce colon cancer growth, which is also, as you all know, a bit of an epidemic these days as well. So again, we go through some of the main ways that CBD is supporting menopause and aging. Generally, I just think that making sure that you are supporting this vital regulatory system in your body is essential. And I think that becomes more essential the older you get and the more stressed out you are. So in today's society, I truly believe that everybody should be on a high quality CBD product, supporting their endocannabinoid system, or getting acupuncture regularly in order to do so. I know there are some chiros here. I would not be surprised to hear that there are techniques that you guys are using that are also supporting the regulation of the endocannabinoid system. But so CBD has been shown to help with hot flashes by regulating the body temperature and reducing the frequency and intensity of the hot flashes and night sweats. Again, it can help improve sleep quality, help reduce anxiety and mood swings, which can be very detrimental for women in menopause. It's going to be supporting bone health and alleviating joint pain and inflammation, which is so common in women who are going through perimenopause and menopause. And just a side note, perimenopause can and often does start around 35 in women. So it's important to get them supplementing right away. And I do think that CBD plays an interesting role in terms of helping support fertility. So if you have a woman who is 35 and older, I do think that getting them on a CBD product as they're looking to start their journey towards parenthood can be really helpful. So again, I mentioned CBD and cancer, particularly colon cancer, but it was interesting to see that endocannabinoid dysregulation is also correlated with various gynecological cancers. So endometrial cancer is correlated with the overexpression of CB2 receptors, which suggests a role in tumor progression. In ovarian cancer, increased MAGL enzyme activity was linked to aggressive cancer growth. And in cervical cancer, TRPV1 activation correlated with metastasis. So CBD's anti-cancer mechanisms are that it induces apoptosis, it inhibits tumor migration and angiogenesis, and it regulates key cancer pathways. So the VEGF, the TIMP1, and the inflammatory cascades. So I think that there's a tremendous amount of potential for looking at not only CBD, but other cannabinoids for cancer research. Just a side note in terms of the research, as somebody who's watched the research closely over the past decade, it started with a lot of research on actual plant medicine. So on actual whole plant extracts of CBD and hemp, right? Which is really important because you're getting what they call the entourage effect. We all know the entourage effect. It's the idea that the whole is bigger than the parts, right? So CBD is just one constituent of this beautiful plant that we have interacted with for thousands of years. The other constituents are the terpenes, different polyphenols, different salts and minerals. So these all have their medicinal role and their role to play in our body. And so when we started researching CBD, that was a lot of where the research was going. But once Big Pharma sort of got their hands in it and they started to make Epidiolex and Sativex, which are both pharmaceutical grade products of CBD isolates, for epilepsy and for MS, then most of the research has just been focused on the pharmaceuticals, right? And so to me, it's really important for us to find ways to do a high quality research on whole plant extract. And I think a lot of you have probably started to hear about CBN and CBG and CBC, these other cannabinoids that are now being researched. These are going to have tremendous impacts on the body as well. So CBG actually activates the CB1 receptors directly, but it doesn't have the psychotropic effects that THC does. So that's very interesting for neurological conditions. CBN is phenomenal for supporting with sleep. And CBC, I haven't nerded out on quite enough yet to give you much information on, but it's really exciting because, as I said, there are over 113 different cannabinoids, and CBD and THC are just 2 of them. So we really need high quality research on the whole plant. And in fact, if you look at different research studies, particularly there's this one meta-analysis that was done a couple of years ago that looked at Epidiolex, the seizure medication, versus a whole plant extract in regulating pediatric epilepsy. And what it found was that Epidiolex, the pharmaceutical, we needed 4 times the amount of the whole plant extract. And it also had 4 times the amount of both mild and severe side effects. So that just shows how important these other phytochemicals are in terms of making these products as safe and effective as possible. I also highly encourage that you are getting products that have that 0.3% THC in it. A lot of people shy away from that. And obviously there are some patients who have jobs where they're getting drug tested, and it is unlikely but possible that they could test positive for THC with that 0.3%. But that 0.3% really powerfully enhances the effects of the CBD. They work very synergistically together. And honestly, if you're working with people with severe pain, with epilepsy, with other neurological conditions, I do encourage you to consider increasing that THC a little bit as well, or adding some more CBG to support that. One of the great things about CBD is that it competes with THC. So it's going to help modulate that psychotropic effect as well. So you can still increase the CBD and increase the THC a little bit and get it so that people are not feeling those psychotropic effects powerfully, but getting the more powerful pain management or symptom management for severe neurological conditions. So again, I'm always a believer of less is more. With CBD, its efficacy works on a bit of a bell-shaped curve. So most people start with about 10 to 20 milligrams a day and increase over time. I would say that most people end up with about, so for me, most people who are taking Radical Roots are taking 1 full dropper twice a day. And so that is 16.6 milligrams twice a day. And that seems to do a really great job for most people. It depends on what kind of product you have and what you're doing. What I often have my patients do is just increase by 1/4 of a dropper once a week. Like have them start at about a half a dropper, increase by 1/4 dropper once a week until they sort of feel that maximum efficacy. But often with CBD, again, more is not better. If you have people with severe neurological conditions, often the research will indicate that they need sometimes upwards of 200 milligrams a day. I don't find that to be necessary with my seizure patients, especially when they're using my formula Remy's Revenge that combines Chinese herbs with CBD. But it's all on a case-by-case basis. I often recommend that my patients will start with CBD at nighttime so that if they are sort of sleepy from it the first time, they can just go to bed. But again, just start them low. I've seen very little side effects from CBD. I've had, I think the only bottle of Radical Roots that was ever sent back was my topical, and it was sent back once because it smelled like herbs. And I was like, it is herbs, but here's your refund. You do need to be careful of the drug interaction. So let me go through some of those for you now. Where is it? Okay. So CBD is a potent inhibitor of the CYP3A4 and the CYP2D6 pathways. So basically, it is going to increase serum levels of multiple drugs, including SSRIs, calcium channel blockers, benzodiazepines, antihistamines, antiretrovirals, some statins, tricyclic antidepressants, antipsychotics, beta blockers, opioids, and warfarin. What I find, it's a cytochrome P450, and there's a grapefruit warning. What I find interesting about that is when it's increasing that serum level of particularly things like SSRIs and opioids, it's a really great opportunity for you to work with your patient and their prescribing doctor to start weaning them off of those medications that do have long-term deleterious effects while increasing the CBD to make sure that they're safe, because they work so synergistically and they work on so many of the same pathways. It's a really safe and easy way to work with your patients and their doctor to wean off of some of these meds that have serious side effects. Obviously, you need to check with the legal status in your state. Some states are a little funky about this, but nationally, basically, CBD is legal as long as it has less than 0.3% THC. I don't know how many of you take CBD, but I could drink an entire bottle of a 0.3% CBD product and not have any psychotropic effects. It's not 0.3% is a very arbitrary number that they came up with, but it's also incredibly safe. So, and yeah, I mean, the more we all know, our patients are not very aware of what's going on in their bodies. So try and have them track and pay attention. I don't know if you guys have the same experience as me, but you'll send a patient home with some herbs and they'll come back a week later or like 2 weeks later and they'll be like, no, I don't think the herbs are working. And you're like, fascinating. So you just said that your digestion's better, your sleep is better, everything we've been working on and everything that the herbs are addressing are better, but you don't think the herbs are working. Anyway, I digress. Patience. Gotta love them. Let's see. So again, there are various different forms of CBD. The oils are fantastic because they're absorbed sublingually. So that's very rapid onset. So particularly people who are dealing with pain management, seizures, people who have digestive issues that are going to make it more difficult for them to break down foods, supplements in their gut and really absorb them well. The tinctures are great. For severe gynecological issues like endometriosis, or pelvic inflammatory disease, I have had patients make suppositories of my products, or I believe Palmetto Harmony. They used to make them. I think they still do, if they're still around. I should have checked on that before this. But there are some companies that make CBD suppositories, and that can be really helpful for people who have really severe pain from endometriosis. So you're getting more actively to the area. Topicals can be great. I'm always amazed at how angry people get at me when my topical is out of stock. And so topicals can be really, really beneficial for people dealing with pain management. Highly recommend them. Let's see. And then CBD with acupuncture have very synergistic effects, including pain relief and relaxed states. It's, if you want to give it a good hack, you could just give your patients a dose of rest and relax before they get on the table. And by the end of the treatment, they're going to be double the zen than they would have been otherwise. But I think it's really, they work incredibly well together. And there's a lot of reasons why. And the main reason is because they're both affecting the endocannabinoid system. So I've mentioned a couple of times full spectrum hemp and the entourage effect and why it's so essential that you are getting a whole plant extract. So largely in the market, what's known as the gold standard is what we call CO2 extraction, right? The thing about CO2 extraction is that it doesn't maintain the integrity of the terpenes as well as some other extraction techniques. It's very clean, it's pretty cheap, and it's effective. It gets a high amount of cannabinoids out, but it really doesn't maintain that quality of the terpenes, which are very essential. So the terpenes, if you don't know, are the volatile oils that are within the plant. So if anybody smelled marijuana before, it has a very potent smell, right? That's all of the terpenes. So if you can tell by the smell of the plant, you know that these terpenes are incredibly essential for their healing benefits as well. And we see these terpenes in our Chinese herbs also. So what I love in terms of extraction and what my favorite methodology is spagyric extraction. And some of you guys might have heard of this, but it's an ancient alchemical extraction that really honors the plant in every way. So what is done with this is, so my manufacturer, Warren, who lives up in the mountains here in Colorado, he tinctures all of our herbs, our Chinese herbs and our hemp, in organic grape alcohol. So that's said to take the spirit out of the plant. And then he takes all of those herbs and he burns them for 8 to 10 hours. From the ashes, he's able to reconstitute all the salts and minerals. It's super cool. Check out his website, evolvedalchemy.com. If you've been wanting to start a product line, I shouldn't promote him as much as I do, but I love Warren. And he just does incredible work. I really think spagyrics is the most powerful and potent way to get our herbs out there. But so he reconstitutes all the salts and minerals, and then he takes those and he puts it back in the alcohol. So those salts and minerals are said to be the body of the plant. So we've got the spirit and we've got the body. We bring it back together and it creates this incredible chemical reaction. And I'm telling you, the products that we make are so much more potent than anything that I've seen on the market. We also buy our herbs raw, which gives me a lot of psycho control over it. So everything is bought from Spring Wind. I've never cut a corner anywhere. I probably should. I would maybe make more money. There's my dog. Sorry about that. So in terms of the formulas that I recommend, I love when practitioners use our complete spectrum, because many of you are going to be customizing your formulas for your patients as they are and making sure that they're getting the right formula for them. This allows you to continue doing that while making sure that they're getting that high potency, very clean, full spectrum hemp extract as well as a supplement. So the complete spectrum is fantastic. It's one of those that, like, I always recommend that people try it. That's the one I normally send samples of, because it just, once you taste it, it's just so potent and so fresh. We use hemp that's biodynamically grown. They do no-till farming. It's all sort of absurd, but really beautiful at the end of the day. And you can taste that very clearly in the complete spectrum hemp. Our Rest and Relax is basically a Shen tonic. So that is our bestseller, and it's our bestseller by far and for a reason. This one is a product that people constantly ask if they can just drink the whole bottle. It tastes really good. It is nourishing the heart, clearing heat, moderate moving the liver. It's basically a highly modified Swanzhou Ren Tong, but it's great for generalized anxiety as well as sleep. And then our relief remedy, as I mentioned before, is really powerfully moving the qi and the blood. And this one is great for pain management. It's got a lot of really powerful herbs to modulate pain. And with Radical Roots, pretty much all of our products have a therapeutic dose of these high spectrum hemp extracts. So we have the Chinese herbs so that we can sort of differentiate and make sure that people are getting the right formula for what they're looking for. But we also have that base of full spectrum hemp. So you're going to get all of these benefits that we've just been talking about from any of these products. So your goal is just to pick the formula that best matches your patient's current ailments. And then you can modify that as you will. Or again, if you have your patients on their own herbs, then just throw in the complete spectrum and it's going to be really simple. All right. And last but not least, I'm sure I left a ton out and hopefully you guys have some good questions. But again, it is my great honor. It is one of the two greatest honors of my life to practice this medicine. The other honor is being my son's mama. And I really love what we do. And I really think that as a field, we have so much potential if we work together, and if we work together to get more information out about all the incredible work that we do. I know there's some veterinarians in here also, so that's cool too. I love using CBD for pets as well, just a side note. And I love what you guys are doing in terms of bringing herbal medicine into our veterinary sciences. As you know, I've got a dog, so I'm quite a fan of that. But I really, really just want to I want to encourage you all to get out there, to spread the word, to keep doing the incredible work that you're doing. And if there's any way that I can support that, or if you have any questions about anything we talked about today, please do not hesitate to reach out. You can always reach me at chloe@radicalrootsherbs.com, and I will be more than happy to support in any way I can. So that's about it. I think I talked a little fast, but we did it.
Great job, Chloe. Thank you so much. Everything was very well said, but I know we only have about 9 minutes left, so we'll try to answer these questions if that works for you.
Cool.
All right, let's see. We have, how does this hemp differ from hemp protein, et cetera, in the effect on the diet?
From hemp protein?
Yeah, how does this hemp differ from hemp protein, et cetera, in the effect on the diet?
So hemp protein, my understanding, is more of a omega supplement. Most of that hemp protein, I think, is made from the hemp seeds, which is very high in both omega-3s and omega-6s. So that is more of protein. This is more as a supplement in terms of supporting the endocannabinoid system.
It's very different. Okay. How do we know that the endocannabinoid system develops before the nervous system is an anatomical structure connected to the ECS?
There is not an anatomical structure connected to that. That was just some of the research that I found that was stating that it was developed before that. So I'm not sure how they figured that out, but that was what I was told. That was what the research was saying. So I can look deeper into that research study and see if I can get a better answer for you.
Okay, thank you. You mentioned that hemp is a bioaccumulator in soil. Is hemp also a bioaccumulator in the body after ingesting?
Not that I know of. That's a really good question. I would be really curious about that. I haven't seen any research indicating that, but that would be pretty incredible if it does. I would imagine that its effect on the endocannabinoid system is going to have regulatory effects on our, it's supporting the immune system. So it's hopefully going to be supporting our detoxification pathways by supporting the gut in the way that it does. It's certainly supporting detoxification that way. So possibly in certain ways, I will definitely nerd out on that. That's an interesting theory.
Yes, that's a very good question. If someone takes estrogen blockers for breast cancer treatment, can they use CBD?
From the research I've seen, it looks very safe. I would be hesitant probably just because I don't think that the research that I've seen has been very high quality. So I would probably go with no on that, just to be safe.
Okay. Did you say something about what dose is recommended for fertility?
So for fertility, what was interesting about that is that it's a lot of these fertility issues seem to be correlated with a disrupted endocannabinoid system, which is what we see with a lot of these other hormonal based disorders, right? So some of that is that there's too much anandamide, which is one of the endogenous cannabinoids in our system, and these enzymes might be low, so they're not breaking them down quickly enough. So that's why I think it's super essential that we keep it fairly low. So I always recommend about 10 to 15 milligrams twice a day for fertility. And again, really stress the high quality, full spectrum products, whether they're mine or somebody else's. I'm always happy to recommend other products as well. I'm not the only good one out there, but there are less and less small companies selling hemp because it is incredibly difficult.
Let's see, CBD plus 3% or 0.3% of THC are best for pain?
So CBD to be legal in the States has to be less than 0.3% THC. So that's what all of our products are. If you are working with a patient who has really severe pain and that's not moving the needle as much as you're looking for, THC, since it directly acts on the CB1 receptors in the brain and the nervous system, can really potentiate those actions. So even just adding a little bit more THC. So if you're in a state where it's legal and they can get like a tincture, often I'll have patients who are dealing, again, I work primarily with pediatric neurological patients, but I'll have, if they're dealing with seizures, I live in Colorado, so we can do this. I'll have them get a THC tincture and add a certain amount into our CBD product. So the CBD is going to help reduce the psychotropic effects, but the THC is going to bump up the efficacy on pain management and neurological conditions for sure.
Please share the counteraction with other prescriptions or herb supplements.
Counteractions.
I wonder if they mean contraindications, maybe? I'm not sure.
Well, as I said, it's mainly the main concern is that it's activating these various pathways within the liver. So any medication that has a grapefruit warning is something that you want to use caution with. Likely, it's going to be okay. I've never seen any adverse interactions when I have my patients take them a couple hours apart. But again, you just want to be cautious of this and also let their prescribing doctors be aware that this is something they're on. And again, a lot of times that increase of the serum levels, so since CBD is activating the same liver pathway, then it's going to slow down the degradation of some of these products and pharmaceuticals. So we're going to see increase in serum levels. So CBD can be helpful, again, working with their prescribing doctor to start weaning off of some of these things, especially opioids and SSRIs. But I can read the list of the drugs that it's contraindicated or like has some issues with. So SSRIs, calcium channel blockers, benzos, antihistamines, which are really correlated with an increased risk of Alzheimer's and dementia, if you guys are not aware of that. So get them off of that. Antiretrovirals, some statins, tricyclic antidepressants, antipsychotics, beta blockers, opioids, and warfarin. So those are all use caution with, and certainly separate the timing, go slow, start low, and talk and make sure their doctor is aware that they're on it because they might be able to wean down. So it's a great way to open the conversation with their doctors as well.
Okay. Have you tested and I may be saying this incorrectly, but the Wo-Ma-Ren in TCM herbs for THC and CBD concentration?
Oh, Ho-Ma-Ren? So Ho-Ma-Ren is the seed. So I would guess that also has I would guess there's a low level of CBD in it, but I would guess that there's good levels of omegas in there. So I haven't had it tested. I don't know if there is testing on that. I wouldn't assume that there is, but as we know, it does also powerfully support gut health and nourishing the intestines by nourishing the yin, and fantastic herb. I actually don't have any of it in my pharmacy. Fascinating.
And thank you for correcting how I said that. I knew that was going to come out wrong.
I mean, my pronunciation of the Chinese herbs is probably awful, so it's certainly
better than mine. Earlier at the beginning of the presentation, Chloe mentioned that our diet has gradually been less food with cannabinoids. What other food has cannabinoids besides hemp?
So hemp was actually just a big part of the diet. So one of the things that I found really interesting was I saw a study that chickens used to eat hemp. And so when a chicken would lay an egg and then you cook the egg, so when you're making hemp or marijuana, you cook it, so you decarboxylate it. So that heat changes the chemical constituents of the cannabinoids, right? So when you cook the egg from a hen that was eating hemp, you would get like 500 cannabinoids per egg. So it was kind of insane. So that was just a part of our diet. So it depends how it's processed and whatnot. I don't know of other plants that have cannabinoids, but there may be some.
Okay, well, I want to be respectful of time. Thank you so much, Chloe, for doing this. And thank you all for joining us today. If we happen to miss any questions, feel free to reach out to us at marketing@lasaoms.com and be on the lookout for an email with a promo code, which is CWWebinar225 for 15% off site-wide and a link to view the slides. Thank you so much again for joining us, and we look forward to seeing you next time at the next webinar.